Hello everyone, this is Nagema and thank you for joining me today for our session to work on core strengthening your abdominal wall, your abdominal muscles, which is one of the main treatment to help you relieve your back pain. So today we're going to go over a series of 10 exercises. It's a progression. It's very important to perfect and be able to do the first exercise well and without any back pain to move on to the next one, and same thing to move on to the third one. Before we go over these exercises, I would like you to understand the importance of our abdominal muscles to support our low back and help relieve some of the back pain we could have. So the most important muscle, which is the deepest one, is the transverse abdominal. It's actually laying down horizontally along your low back, along your stomach like this. That stabilizes your low back, supports your low back like a back belt or a lumbar support that you could be wearing externally. Then on top of that, you're going to have the rectus muscle that is straight, laying down straight down. And then on the side, you're going to have the obliques. So the first exercise we're going to start with, it's going to be working on a progression of strengthening your transverse abdominal that research has shown that is really weak in patients with back pain, and that most patients that actually cannot contract and activate that muscle that supports your low back naturally. So we're going to start in this position, laying down on your back with your legs bent, which is usually the most comfortable for your low back. So the first exercise we're going to do, it's going to be called the abdominal draw-in to activate and contract the transverse abdominal. So you're going to put your hands just along your low back, your lower stomach area. You can slide your fingers just a little bit inside your hip bone towards your belly button. And then you're going to try to bring your belly button down towards the floor. You try to pull your stomach in like you would like to do it when you have to put on your skinny jeans or zip up very tight pants. So it's just the lower part of your stomach that you want to pull in and tighten up. You don't want to tighten up your shoulders, your legs, everything else is relaxed, and it's just the area below your belly button that you want to pull in. So pulling in the belly button down towards the floor, you're going to hold this contraction for 3 to 5 seconds. 1, 2, 3, 4, 5. And you can start with a series of 5 repetitions and work yourself up to 10 repetitions for this. As a progression, you can start off by, again, tightening up your stomach in, bringing your belly button down towards the floor, and lift one leg up at 90 degrees and maintain that leg at 90 degrees for 3 to 5 seconds. 1, 2, 3, 4, 5, and you relax. You can start with 5 repetitions. Squeezing your stomach in, lifting your leg up, and hold 5 seconds. 1, 2, 3, 4, 5. Again, we squeeze the stomach in, hold it tight. 1, 2, 3, 4, 5. So we start with 5 repetitions on each side, and then you can work yourself up to 2 sets of 5, 2 sets of 10, 2 sets of 15. Once you can do that without any back pain and it starts getting easier, the next one, you start the same way. You squeeze your belly button in. You're going to start at 90 degrees and you're going to bring your leg, lower your leg down like this. You straighten it out, down. Squeeze your stomach in, start in this position and you kick your leg down. 2. Squeeze your stomach in and kick your leg down. 3. Squeeze your stomach in and kick your leg down. 4 and 5. And you can do the same thing on the other side, of course. Squeeze your stomach in, start in this position and you kick your leg down. 1. Squeeze your stomach in, kick your leg down. 2. 3. 4. 5. The next exercise, the dead bug, you can combine legs and arms. So starting squeezing again, contracting that transverse to support your low back, squeeze your belly in. You're going to lift one leg at 90 and at the same time you're lifting one arm. You can do the opposite arm up. Okay, squeeze your stomach in, you lift your leg and opposite arm up. And you can hold it for a few seconds and down. 2, 3, 4, 5. It's very important to always start by activating your transverse abdominal. 1, 2, 3, 4, 5. The other exercise is the leg lowering. So you're starting in a position where your leg is up, you squeeze your stomach in and you lower your leg slowly. So it's very important to lower your leg slowly down. Same thing, we can start with 5 on each side and work our way up to 10 and up to series of 15 repetition. The whole time your stomach, your belly should be contracted inwards towards the floor. The next exercise is bridging. So for bridging, you're squeezing your glute muscles, your stomach, and you're lifting your hips, your buttocks off the floor as far as you can if you don't have back pain. Otherwise, you stay down and don't lift it as much. Ideally, you want your knees, hips, like your knees, buttocks, and shoulders to be in the same alignment. So that's the position you want to be in. You want to hold it for 3 to 5 seconds and then you relax. And you're going to do a series of 5 to start. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. The next exercise is for the rectus abdominis. It's going to be planks. But we're going to start in a modified plank position. So you're starting on your elbows and your knees. And only move on to this exercise if the previous ones are becoming easy and you don't have back pain doing them. In this position, you tighten up your glutes, tighten up your stomach, and you're going to lift your stomach up, trying to keep your hips, shoulders, and knees in the same alignment. You can hold this position for 3 to 5 seconds to start and work yourself up to 10, 20, 30 seconds or even longer. Squeezing your stomach, squeezing your glutes, and you hold yourself up like that. Once the forward plank in this modified position becomes easier, the next one is going to be the regular forward planks on your feet and on your elbows. And same thing in this position, you want your hips, shoulder and feet to be in one straight line, starting to hold it for 3 to 5 seconds, and you work your way up. You don't want your buttocks to be sticking out like this or down, sinking down. You want them to be in a straight alignment. The next exercise is working on your obliques. So you can start in a modified position, okay, the lateral planks on your knees and your elbows. You squeeze your stomach, squeeze your buttocks, and you're going to lift your hips from the floor. And you want your shoulders and your elbows to be in the same alignment. You can start with 3 to 5 seconds on each side and work your way up to 10, 20 seconds, 30 seconds. Each time you want your shoulders, hips, and knees to be in the same alignment, same line. And of course the last one is the regular side planks. You can do it on your feet and on your elbows. Squeeze your stomach, squeeze your buttocks, and we lift and hold. So we went over a series, a progression of 10 exercises that you can do to improve your back pain. So those core strengthening exercises, or you can even do those when you have a diastasis, like a separation of your abdominal wall during pregnancy. But it's very important to do the first exercise to learn how to contract your transverse properly and do it without back pain before you move on to the second one and the third one. Thank you for watching me, and I wish you a very healthy back. Thank you so much for watching my video. I hope you enjoyed it. Please subscribe to my channel and hit the bell to get notification for my future videos. Thank you so much.